Touch base with Bentura Kwamboka, the new kid on the block. Bentura, over to you. Tell us exactly the numbers and what it is we need to know about healthcare in the country.
Well, thank you so much, Dennis Aseto, for that. As you rightly put it, we are going to discuss about the state of healthcare system in Kenya. Our specific focus on the Social Health Authority and the Social Health Insurance Fund. We have a primary healthcare. We also have emergency and chronic care. Remember, early this week, the Social Health Authority actually released the enhanced package. That's the maternal and oncology package that has boosted the cancer care from 550,000 shillings to 800,000 shillings annually for cancer care, for cancer patients to seek care under that particular package. As you rightfully put it, is it a package that is going to work for most cancer patients in the country? That and much more we'll know later on in that subsequent discussion. But right before that, I can take you to some statistics and data on the state of the Social Health Authority in terms of registered members of that particular Social Health Authority under the Social Health Insurance Fund. Initially, the authority had targeted about 15 million registration in the transition phase. Remember that they had targeted that number to 15 million, and initially they had projected that that number is to surpass the NHIF number, which was about 8 million people who are under the now defunct NHIF cover. And a few weeks later, we can see from the data here, about November 2024, over 14 million Kenyans had registered under the Social Health Insurance Fund. And as of November 2025 to early this year, that's around May 2026, we had a total of 27 million to about 30.7 million Kenyans registered under the Social Health Insurance Fund. And also we have a very specific population that's around 2.2 million vulnerable Kenyans who are already enrolled in the fund. And the Social Health Authority had targeted about 100% cover population. That's about 40 million Kenyans who are going to be covered under that. That's it for the number of people who are registered under the Social Health Insurance Fund. And some of the health facilities, of course, we cannot have that fund without including the the health facility. As of October 2024, about 1,442 hospitals had signed SHA contracts. And fast forward to February 2025, about 8,813 health facilities were enrolled in SHA. And as of November 2025, over 10,540 contracted facilities were under the SHA. The contracted facility, we have about 10,540. That includes public facilities. We have a private facility and faith-based hospitals that were contracted to provide those services. The authority also is targeting about 17,755 active health facilities that we have in the country. So as much as that's as far as health facilities that have been registered under the Social Health Authority. Some of the accredited facilities, we have about 5,849 public facilities that have been accredited to provide those services. And also we have 4,337 facilities that's privately owned to give that particular service to Kenyans, and about 522 faith-based facilities, that's the religious organization, bringing it to a total of about 10,708 facilities accredited to provide those services. An interesting data to note here is about 140 facilities were accredited to provide comprehensive cancer care to patients across the country. Something to note is that about 40 facilities were actually suspended due to fraudulent claims to NHIF, and thus far about 1,300 hospitals have been closed over the same fraudulent claims that they made towards the Social Health Authority. About the NHIF debt, of course, the defunct NHIF had a debt that had accrued. A total of about 33 billion shillings was accrued by NHIF. That's an amount that a couple of hospitals are owing, are claiming from government for payment. Early this month, about 4 billion shillings was released to be paid to hospital facilities that have a debt of about 10 million shillings. If we can go about the debt that is owned by SHA, that's about a year and almost a half into the operationalization of the Social Health Authority. We have about debts estimated about 13.7 billion shillings. That's the amount that SHA owes hospitals, approximately 5.7 billion shillings for faith-based hospitals. And also we have a debt that is owed by to public hospitals on the same. That's the statistics that we have about the Social Health Authority, and some of the counties that the counties that are owed huge sums of money by the Social Health Authority. That is Kisumu, standing at 1.87 billion shillings, and also we have Nyeri at 633 million shillings, and subsequently Nakuru at 609 million shillings rather. That's the current state in terms of statistics and data of how far are we with the Social Health Authority in terms of registration, debt owed, and facilities registered. And now I hand you over back to Dennis.